Hi, my name is Ritchie Stevens. I'm the medical director here at 5D Cancer Services. I've been in the oncology business for approximately 36 years. So it's been a great ride, and we have so many new technologies. It's been a very exciting field to be in. I was born in Walnut Creek, California. I grew up in Bay Area, just over the hill from Berkeley, where my dad was a PhD candidate over there. And lived there till I was about 6 years old with one brother and my parents. We then moved to Washington, D.C., where my dad worked for the Forestry Service, and we were in Silver Spring, Maryland for about 3 years. And then made the major move back to Colorado, Fort Collins, Colorado, for the majority of my schooling and college and medical school. Well, I've always been an outdoor enthusiast. I grew up as a competitive swimmer and tennis player, and participated through the Intermountain area, played some professional tournaments, worked as a tennis pro for a number of years. Yeah, Colorado was a great place to grow up for that. Clean air, you know, being outside, enjoyed skiing and other athletic activities as well year-round. Well, I think I was influenced in the high school era by some of my friends who had parents as physicians, and I spent some time with them, sort of seeing what they were doing, shadowing with them, and you know, I could tell about the contribution they were making in the community, and I think that kind of got me motivated in terms of being a physician. I ended up going to Colorado State University, got an undergraduate degree there, worked part-time in nursing homes, taking care of the patients to get some medical experience additionally, and ultimately got accepted into the University of Colorado for medical school. I graduated medical school in 1986. I then did an internship in San Francisco and a residency program in Southern California at the University of California, Irvine. Completed that in 1990, and then basically took a job in Las Vegas, and I worked in Las Vegas for 3 decades before coming up here to St. George. Well, I didn't even know about the radiation oncology field until I was sitting in a conference as a third-year med student, and they were talking about basically doing breast-preserving surgeries, taking a lumpectomy or taking a lump out and then giving radiation afterwards. And I thought to myself, geez, I wonder who does this kind of stuff. And I found out that way down in the basement of the University Medical Center was a radiation oncology department. And we went down there, rotated through. I thought this was a pretty cool, especially it sort of involved radiation, which I had some interest in, and you know, coupled with cancer care, it was kind of the perfect field for me. Well, I had a very busy practice in Las Vegas, and one of the biggest changes, there have been sort of monumental changes every decade or so in radiation oncology, and adaptive therapy really came probably a decade ago in terms of the belief of what it could do for patients, being more precise, decreasing side effects. I thought this is great technology, and that kind of spurred my interest on it initially. Over the last 5 years, the availability of adaptive machines has become more of a reality, and so it's been great to be participating in that arm of our field. Well, adaptive radiotherapy is the ability to actually change the position, in relationship to different positioning and shapes of the cancer inside your body. You don't have any control over that, but every day when we basically get ready to treat somebody, we take pictures on the inside of the body, and we can see, well, we want to make sure that the cancer is in the crosshairs of the radiation beam. And sometimes because of more urine in your bladder or maybe more gas in your rectum that day, the tumor might have changed position a little bit, and healthy structures may be more in the target zone. Adaptation therapy, having an adaptive linear accelerator, allows us to make adjustments every day if we have to correct for those positional changes and shape changes that 99% of the machines in the United States can't do. The Gemini 360 machine is the first machine in Utah that has adaptive capabilities. And that means that basically, depending upon a day or a week, if the cancer is shrunken, if it's gotten bigger, if there have been changes of position inside the body, the Acasis machine, the Gemini 360, can actually adapt so that we can deliver a precise smart bomb therapy every single day. Probably only about 1% of all machines in the country have adaptive capabilities. In fact, this machine, the Gemini 360 here in St. George, is the very first adaptive machine here in the state of Utah. So it's impressive that St. George gets the best technology in the state first. Well, frankly, I'm a Utah resident, so I wanted to do something close to where I live. And fortunately, this facility, including the vault, which is the bunker, essentially we give the radiation treatments in, came available. And we thought that this would be an unbelievable place to bring this technology first in Utah too. Well, adaptive therapy allows us to, in many instances, not all cases, but in many instances, allows us to reduce the number of treatments or the number of fractions we give a patient. Historically, therapy went on for 6 to 8, sometimes 9 weeks for certain types of malignancies, every day, Monday through Friday. But because of our precision, we can treat the cancer more precisely, which allows us to increase the dose of the radiation treatment so we can deliver fewer fractions or doses, but provide a higher dose per day. We can do that in part because we can adapt the plan each day so that we're not trying to fit a round peg through a square hole. We can adjust every single day to make the therapy fit very nicely around the cancer while at the same time excluding the normal structures. A patient would come to the office. Usually ahead of time there has been what we call a simulation, which is a picture-taking session with a CAT scan or an MRI scan that helps us to design the radiation plan. Once that plan is created and approved, then the patient actually comes in to start their treatment. And depending upon if they're 5 days or if they're 4 weeks, the patient would come, check into the office. When we're ready for them in the back, we bring them back, we lay them down on the treatment table, and we proceed with a scan that day to make sure that the target will be in the crosshairs in accordance to the plan. If it's not, then we basically recreate a plan on the table, which is the unique thing about the Acasis 360. No one else in the state can do that. But we'll recreate a plan so that we can precisely encompass the tumor on an everyday basis. Treatment takes about probably between 5 minutes maybe for the radiation to be delivered, but the overall treatment time or time that a patient spends in the room may be 15 to 20 minutes in terms of obtaining the initial localization scans, setting the patient up appropriately, delivering the therapy, and then exiting the room. We here at 5D Cancer Services believe in the AIM approach, and that's a program of 3 components which are sort of make the pillars of a good quality radiation center. Number 1, the A stands for adaptation. That's, as we've mentioned, is the ability to adapt the radiation plan on a daily basis to tightly conform around the cancer, and also to exclude the normal healthy tissues around the cancer from the radiation high dose area. The I in AIM stands for imaging, and the Acasis machine is the only unit in the state of Utah that can actually image the tumor site through a cone beam CT or regular x-rays during the actual treatment, so that if we have marker seeds placed in a cancer, we can identify any positions in change or any change in positions during that radiation treatment and stop the machine if we have to, if the target area gets out of whack. And both those things, adaptation and also the imaging that we can do throughout the whole therapy, allows us to decrease the margin that the radiation is given to a cancer. The margin is the extra buffer zone around the cancer that physicians like myself place so that we make sure that we don't miss the cancer. And because we can adapt And because we can image so well, we can shrink those margins down. And margins are critical in terms of side effects. The smaller margins that we can provide, the markedly less side effects that a patient can experience. So it's the best of all worlds. More accurate radiation to the cancer, better imaging, and making sure we're in the crosshairs all the time, and using smaller margins which decrease side effects. Side effects are really entirely dependent upon what part of the body we're treating. So, in other words, if we're treating a prostate low in the pelvis, we have other structures that are in the area, such as the bladder or the rectum. So, a prostate patient may have more frequent urination, a little bit of burning when they urinate. They may have a little stool loosening. We can do some measures to limit that, but using the adaptation, we can try to minimize the amount of radiation given to those healthy structures every day, which generally speaking is going to cut in half the side effects that patients may experience versus conventional machines. And why does a cancer move? What makes a cancer move? Well, sometimes it's rapid shrinkage of a cancer or growth, as we can frequently see when we treat cancers in the head and neck area. They can rapidly shrink in size, which basically brings sometimes normal structures which were outside of the zone where we were treating into the radiation zone. And that's where you need to be able to adapt to be able to exclude those healthy tissues. When we're treating in the chest area or in the upper abdomen, just your breathing, the motion of your diaphragm going up and down can move a pancreas cancer, can move a lung cancer. We do a lot of things like breath hold. That commonly works, but sometimes even that, we still have to make adjustments on the positioning of the radiation beam. And when we're treating in the pelvis, say the prostate or the colon, these structures are kind of influenced, and these cancers are influenced by the amount of gas you may have in your rectum or the amount of urine you have in your bladder. So you can't control these movements. These things happen without your ability to be able to do anything about it, and that's why your machine needs to be adapted. Yeah, the Gemini 360 machine, we have the second one in the country, actually. It does have FDA clearance. And as I mentioned, it's an adaptive machine, similar to other machines, but kind of other machines on steroids. Yeah, the Acasis 360 can basically treat every malignancy in the body except for skin cancers. So we at 5D Cancer Services have additional equipment to be able to handle skin malignancies here in southern Utah. There's been a lot of interest recently in terms of treating later stage disease, meaning people that have a limited number of cancer deposits elsewhere in the body. That's called metastasis. And so there's sort of a growing body of evidence that if we treat people that have a limited number of metastatic sites or cancer spread sites, that we can actually impact their disease outcome and improve survival substantially. Radiation oncology in the United States has for decades been associated with cancer treatment, but in Europe actually they've been doing a lot of treatment for benign processes like arthritis, plantar fasciitis, tendonitis, bursitis. There's a much more robust practice of medicine for those conditions in Europe. And that's just beginning to start to come here to the United States. Professional athletes have all sorts of therapies in Europe. The soccer players. Usain Bolt received radiation to his feet prior to the Olympics because he was having foot pain. So there's quite a bit of evidence for arthritis and benign condition treatment, meaning non-cancerous conditions, can be benefited by the use of radiation. And in particular, very low doses of radiation, minuscule doses of radiation by compared to what we do for a cancer. And there seems to be a sweet spot. If we give more radiation, we don't have the same benefit. And so it's a very low dose that seems to actually create an anti-inflammatory environment around a joint versus inflammation. We know here in southern Utah, this is a huge pickleball capital, and that's a game that's just exploding across the entire United States. And unfortunately, a lot of older individuals are picking up the game because it requires less movement than some other court sports. And because of that, people are suffering from their arthritis, which in many instances have been treated in a number of fashions, and it hasn't been successful in alleviating their discomfort. Radiation is one of those things that we can use in very, very low doses, which can have a dramatic impact on pain and suffering from these people. We want people to get back in the game, and that's what we use our radiation for sometimes. Still enjoy playing some tennis at time, but I'm a pickleball player also, and I enjoy that. Southern Utah's been a great place for golf. It's another great activity, and of course, when I'm in northern Utah, then skiing in the wintertime is a fantastic activity for me. I love it. The Cases 360 is a linear accelerator at its core. We have certain capabilities that we can do for patients that other machines can't do. But all of the things that we do basically are reimbursed by Medicare. It's not experimental. There are no extra charges. Everything we do basically is covered by insurance. And we cover most insurances just like every other group in the state would. Beneficial for all patients to have insurance, but if they don't, then we work with them to still provide some service to them. People always ask me what I would do if I had a cancer myself, and ever since I saw adaptation capabilities in radiation therapy machines, I wouldn't go anywhere else. I think that realistically, adaptive therapy and the imaging capabilities that we have, the margin reduction capabilities we have, any physician, if they knew about it, would want to be treated on that type of a machine. We're new to the community. I think a lot, we're trying to introduce ourselves and what our capabilities are to the public as well as the medical community. I would certainly welcome any physician in town who has some interest in, adaptive therapy and what we can do at 5D Cancer Services to reach out. We'd be happy to show them around and discuss, our technology. Once you see therapy adapt, you'll never go back. And I think that that's certainly the case for the Gemini 360.